Sexism or science? This question has occupied me for 2 decades. I've spent a lot of time trying to advocate for including sex and gender in scientific research, particularly health research. And I've also spent a lot of time dealing with the resistance to doing that. And the latter has been the focus of my advocacy work. On this recent poster advertising the new low-risk drinking guidelines for Canada, it says, "It's not sexist, it's science." This neatly encapsulates the issue that I want to talk about. Low-risk drinking guidelines, for the very first time, are sex-specific in Canada. And they may be the first and only sex-specific guidelines in the world. And this is pretty important because there's a big difference. Alcohol has a more damaging effect on women's bodies if used at the same rate. So the new low-risk drinking guidelines indicate that women should have no more than 10 drinks per week and men 14. That's a big difference. What we had been doing in using a generic guideline had been gender blind. And if you think about it, potentially damaging to women's health. So why the confusion, sexism and science? For years, science has used a male norm. A lot of the generic research that we have depended upon for decades has not necessarily been developed with men and women in mind. It's not necessarily been developed with samples that include men and women, and this is still true in certain areas. So that male norm has become the standard, and I think many of you will be familiar with cardiovascular health, for example. Some of the early research on how to treat cardiovascular events was based on male clinical samples, and therefore not necessarily applicable, as we were to find out, to women. Second, we have a knowledge deficit. Because we haven't been inserting sex and gender in science, we actually don't know what we don't know. And that's pretty significant when you think that in health, we're designing treatments, we're designing intervention programs, we're trying to guide policy development with the work that we do. So if you don't know what you don't know, you have a deficit in where you're coming from. A third issue, of course, has been that for many, many years, women have been absent in science or in leadership positions or in running granting agencies or hospitals. Luckily, that's no longer true. But for many years, that kind of experience or that kind of influence on decision-making was absent from how we approached health research, treatment, and policy. And also for many years, we have suffered because we didn't really know how to investigate using sex and gender because we didn't have the right methods or we hadn't thought through the theory. So there has been a history of sexism, which has led to some of the confusion between what is science and what's accurate and what's evidence and what's not. So what are the challenges? We have had to challenge the use of generic data and say, well, maybe that's useful for some groups, but not all groups. And this is extended not just to sex-specific groups, but also age groups, ethno-racial groups, and other kinds of groupings that we haven't necessarily included in our samples. We've had to lobby journals to say, maybe you should reconsider publishing articles that don't tell us about this, that don't necessarily acknowledge that this research was done on men, or this research was done with male rats, and not necessarily, therefore, generalizable to other rats or women. We've had to challenge funding regulations to say to places like the CIHR and the NIH in the USA, how can you fund proposals that don't necessarily address these issues? And many of you may not know, because you may be too young to know, that the institute development process at the CIHR, which took place in 1999, necessitated a huge lobbying exercise that was directed at getting an institute for research on women's health. It did not succeed. We ended up with an institute on gender and health. Better than nothing. We also had to lobby for an institute on Aboriginal health. It was not in the first menu of institutes. So this shows you how there are attitudes that we have to confront as we go forward to try and make gains in science. Now, some dismiss all of this as political and inspired by feminists. Well, that's true. It is political, and it was inspired by feminists. Some of the changes we did get, 1993, the National Institutes of Health experienced a change. A new act was passed in the USA which said, if you're doing a clinical trial, you need to include women, children, and minorities, or you need to justify why that is not relevant to your study. That, by the way, was the result of advocacy that started in 1978. So that's how long that took. The sad part is, when the General Accounting Office in the USA took a look at what effect this legislation had had, it wasn't that great a story. The good news was they found 95% compliance. In other words, 95% of those proposing research to the NIH did answer the question. But the data that was collected through these designs was rarely used or even reported upon, and in some cases not even analyzed. In Canada, in 1999, the federal government passed a gender-based analysis policy. And this was more broad than just research. It was intended to address all departments, all ministries, all policies, not just health, but everything. To say, simple question, did you use a gender lens when you developed this? And if so, what did you find? And then if so, what did you do about that? A policy that would benefit women, but also benefit men, if you were to think about it. Well, in 2009, the Auditor General of Canada, in her annual report, took a look at the effectiveness of the gender-based analysis policy of the Canadian government. Sadly, she found very little application of it across ministries and departments. And when it was applied, similar to the US, very little use of the data that was found. So in a way, you have to say, all of this has been a failure. 40 years of advocacy, and where are we? Still in a mess, in a way, confusing sexism and science. Still trying to deal with both. Still trying to see the politics of this and trying to make our way through it. And what is this about? I mean, are there attitudinal barriers among researchers that say, I don't want to hear about it. I don't want to go there. Sometimes that's true. Are there politics around the use of sex and gender that assume it may be just a passing fad and not something we need to take seriously? Maybe. Maybe all of these things are happening. So what do we do about this? We've raised the issues, we've done our advocacy work, We've evaluated the advocacy interventions. We've done training programs to try and introduce sex and gender to newer researchers. We've tried to introduce these notions to established researchers. We've required funders to ask about these questions. We're developing more and more complicated measures about how you do this and methods for doing it, so it's not for lack of information. I think we have to embrace the fact that sexism and science are conjoined, and that we need to be upfront about that, and possibly to train ourselves in what I call scientific advocacy. So that means if you're a scientist, you actually have to embrace sexism and deal with it as part of your context and name it. And if you're in the general public or in the media or in policy making, you need to engage with science in a really critical way and ask about these things. I think we're moving closer to that goal, where we've got all kinds of populations of interest, not the least of which is the general public, that may one day demand better science in this regard. And certainly integrating sex and gender into science makes it better. So back to drinking in young women in particular. We have experienced in recent years a surge in binge drinking in particular, new patterns of drinking among young women. The new calculations that we have done using the new low-risk drinking guidelines almost doubled the size of the problem of problem drinking among young women in Canada overnight. Just new math. But math that was inspired by science. Math that was based upon knowledge that we had previously not really investigated for and therefore had been able to ignore. So we'd assumed that generic guidelines were good for everyone, and they weren't. And furthermore, we'd assumed, therefore, we had much less of a problem about young women drinking than we actually do. So on every level, public policy, science, sexism, discrimination, we were losing. One of the things that's been aligned as an issue with binge drinking, in particular in young women, is sexual assault. Drug-induced sexual assault, date rape, lack of consent around sex, all of these issues are very much in the news. And yet, what do we do in response? Been some very well-respected columnists who have written, young women ought not to drink as much. Then they might not get sexually assaulted while they're drunk. This is victim blaming. It's inherently sexist. We very rarely ask young men to think about not drinking as much, or very rarely ask young men about what is it that goes into sexual assault from your side of things, or rarely ask those questions. So is it sexism or science? I don't think it can yet be separated. Thank you.